I was really looking for a community hospital experience. I really wanted to be at a place where the physicians and the other hospital staff felt interconnected to the people that they were serving, because that's the kind of community that I want to work in the long term.
What's unique about working with our residents and our attendings is, as a medical student, you take an active role in patient care. You become part of a team of healthcare providers, and there's an expectation that you grow and develop through that experience.
I really enjoyed my rotations. Majority of the time, the attendings were working one-on-one with me, and there's a lot of hands-on opportunities. Here, there aren't a million different teams of specialists. So when I was on the floors, I learned myself how to manage telemetry and patients with AFib. I got to scrub in first assist on nearly every procedure in the ORs.
I think all of the rotations here have been great. I get a lot of hands-on experience. All the attendings are very good here. Even if they have a heavy caseload and they're seeing a lot of patients, they still make sure they take the time to work with us individually and make sure that we're getting something out of each of the rotations that we do.
The attendings here are very nurturing. They really do allow you to grow in your career in medicine. They push you to test your knowledge, to test your procedural capabilities, to test how you can interact with patients. But they're always right there. They always have your back. They're passionate about our education here.
One of my favorite parts about being here is our sim lab. We have an incredibly expansive and state-of-the-art sim lab that we get to work with on a weekly basis. We have opportunities to work with our clinical reasoning skills, as well as go through learning and practicing procedures in a controlled environment where we have the opportunity to try again and again until we get it. And then what I really like is that we get to take those skills and translate that into the real world.
I really love working with the residents, and I think that's mostly because they have been so much more approachable and eager to teach me than I think I was ever expecting. I was really able to work with them through their decision-making process a lot of the time, which has helped me determine how I want to approach different problems, either in a clinical setting or a hospital setting, when I eventually become a resident.
I really enjoy Southwest Michigan. It's beautiful, especially in the summertime. There's so many outdoor activities and the beaches are fabulous. I was lucky to be able to live at Lookout Point, which is an apartment complex owned by the hospital. And it's quite beautiful. A lot of the residents live there and a lot of the medical students. It creates a real sense of community for us.
We very much encourage our students that we want the patients to see you as their provider, that we want you following the patients through. Sometimes you're working with the residents, sometimes you're working just with the attending. In either case, we'll be more than happy to allow you as much reign as you're willing to responsibly shoulder.
If you're considering coming here as a medical student, I think you should come. Give us a try. There's so many little gems that you're going to discover while you're here, from the work-life balance, just the work culture in general, nurturing attendings that actually care about you and your learning. We've got beautiful beaches, so much fun activities to do, hiking in the dunes, paddle boarding. There's a lot of wineries and breweries around, and we all get along great. We do things together outside of the hospital. It really creates a fabulous culture and great place to live.